So I often get asked a question about cosmetic decompression do's and don'ts. The first question I always get asked is, do you do decompressions for anything besides thyroid eye disease? And the answer is absolutely yes. I do most of my decompressions for aesthetic reasons, patients with thyroid disease and those without. And why would you have a decompression if you don't have thyroid eye disease causing your eyes to bulge out? Well, many people seek my expertise in this subject when they have eyes that appear to bulge out because they're very, very nearsighted. And when you're very nearsighted, the eye gets larger. It can get actually a couple millimeters larger and look very, very bulky. You can also look like you have bulgy eyes and an unflattering appearance if you have very small cheekbones or very small facial bones. And this for some patients is a concern, especially when they reach middle age, because what happens when you have a small supporting structure is that you can often have a lot of fat prolapse and it can kind of prematurely age you. And so what I do is I can move the eye back in addition to doing a blepharoplasty. Now, the don't in this is if you have bulgy eyes, don't do a blepharoplasty thinking it's going to make it better. All it's going to do is give more eyelid retraction and really make things worse. Also, don't see someone who doesn't do a lot of these decompressions, because this is not a benign thing. It's a fairly quick recovery in in the hands of someone who does a lot of them. And I do a few hundred per year, and I've done thousands over the course of my career. And even then, I still advise patients, and we have a long discussion about the pros and cons and alternatives and what you can do or can't do. You never want to make this decision hastily, but for some, it's really the only way to improve their appearance and to really target in a very safe manner an improved appearance, especially if you have small cheekbones and small facial bones. The other case, and I've just had one recently, is when someone has or is born with glaucoma that causes the eye to expand. Now, this is a fairly rare condition. It's not like the normal glaucoma that some people get when they're older and take drops. This is a case where in very young people, you can get glaucoma or increase in eye pressure that causes the eye to get bigger, again, looking bulkier. And one of the things that we did here was to actually decompress around the eye and move it back and make it look just normal. And this can be really satisfying for patients. Some patients are just very self-conscious of their bulgy eyes. I know some patients have said that, it's changed their lives, that they always wore a hat, or that they were teased as a child and wanted to do something about it. And you should never do surgery because of something like that or an insecurity. But as you age, if there is an improvement of appearance that it's desired, do seek out someone who does a lot of these types of surgeries. And don't just do a standard type of surgery, such as a blepharoplasty, because it will always result usually in failure and not a very good outcome aesthetically. So I hope that helps to put things into perspective for anyone who has relatively bulgy eyes and wants a much more youthful and improved appearance. Thanks so much.